In this video, we will talk about the intermuscular spaces of scapula. What are intermuscular spaces of scapula? The scapula contains three important spaces that are formed due to the specific attachments of its muscles. They are clinically significant due to the neurovascular structures they transmit. There are three intermuscular spaces of scapula: the quadrangular space, the upper triangular space, the lower triangular space. We will discuss them one by one. Number 1. Quadrangular space. Boundaries. Since it has four sides, so it has four boundaries: superior, inferior border of teres minor, inferior, superior border of teres major, medial, long head of the triceps brachii, lateral, surgical neck of the humerus. Contents of quadrangular space. It has two contents: axillary nerve. It innervates the deltoid and teres minor muscles, posterior circumflex humeral artery. It supplies blood to the deltoid and shoulder joint. Clinical significance of quadrangular space. There is a pathology called quadrangular space syndrome. It is the compression of the axillary nerve, or posterior circumflex humeral artery, leading to shoulder pain, weakness, and possible deltoid muscle atrophy. Number 2. Upper triangular space. Boundaries. Since a triangle has three sides, so it has three boundaries: superior, inferior border of teres minor, inferior, superior border of teres major, lateral, long head of the triceps brachii. Contents. It has only one content: circumflex scapular artery. It is a branch of the subscapular artery that supplies the scapular region. Clinical significance. The triangular space is less commonly associated with clinical conditions, but is important for its vascular supply to the scapular region. The last space is lower triangular space. Boundaries. Again, since a triangle has three sides, so it has three boundaries: superior, lower border of teres major, medial, long head of the triceps brachii, lateral, shaft of the humerus. Contents. It has two contents: radial nerve. It innervates the posterior compartment of the arm and forearm, profunda brachii artery, deep brachial artery. It supplies blood to the posterior compartment of the arm. Clinical significance of lower triangular space. Radial nerve compression. It can lead to radial nerve palsy, resulting in wrist drop, and sensory deficits in the posterior arm and hand. Anatomical relationships of intermuscular spaces of scapula. Muscular relationships. The spaces are defined by important shoulder muscles, including the teres major, teres minor, and the long head of the triceps brachii. Vascular relationships. The spaces transmit key arteries that supply the shoulder and upper arm regions. Nerves relationships. The spaces contain important nerves, such as the axillary nerve and radial nerve, which are crucial for the motor and sensory innervation of the upper limb.